Syndrome of inappropriate antidiuresis due to reset osmostat in small cell lung cancer. Our learning objectives are to understand the clinical presentation, workup, and differential diagnosis for syndrome of inappropriate antidiuresis due to reset osmostat, and to consider a rare pathophysiologic mechanism for SIAD. A 61-year-old woman with 30-pack-year smoking history presented with nausea, vomiting, and diarrhea 1 month prior to admission, and shortness of breath, orthopnea, and leg swelling 1 week prior to admission. On exam, her blood pressure was elevated to 218/117 with an S3 heart sound present, bilateral crackles, as well as edematous extremities. Labs were notable for a serum sodium of 115, serum hypotonicity to 243, urine osm of 216, urine sodium of 44, FeUA of 11%, and FeNA of less than 1%. AM cortisol was 17.8 and TSH was 2.27, both within normal limits. The CT chest revealed a mediastinal mass. A pleural effusion was diagnostic for small cell lung cancer. Further imaging revealed stage 4 small cell lung cancer with superior vena cava syndrome, left frontal lesion, and liver metastasis. The patient was treated with chemotherapy, carboplatin, and etoposide. In the following months, she remained mildly hyponatremic. 7 months later, the patient developed nausea and vomiting with hyponatremia to 116. She was admitted, and following improvement in the serum sodium from 115 to 133, her urine osmolality increased from 143 to 771. The patient was diagnosed with SIAD with reset osmostat due to small cell lung cancer. This graph demonstrates the patient's urine concentrating ability, with serum sodium on the x-axis and urine osmolality on the y-axis. This graph demonstrates that the patient's sodium regulation can allow the serum sodium to go to very low levels, causing symptoms. The characteristic of a reset osmostat is that it can dilute when serum osmolality falls, thereby preventing severe hyponatremia, but concentrates inappropriately even when hyponatremic. It is inappropriate because the urine osmolality is so high even when the serum sodium is still low. Reset osmostat comprises a change in the normal plasma osmolality threshold, a reduction or an increase, which consequently induces chronic dysnatremia. Although early papers on reset osmostat state that hyponatremic patients with this condition are usually not symptomatic, the current view is that most patients with hyponatremia are symptomatic and should be treated. Reset osmostat has been associated with many clinical conditions and has clear diagnostic criteria, which are crucial to arrive at the correct diagnosis and treatment. Patients with reset osmostat excrete 80% of a water load, 10 to 15 milliliters per kilogram, given orally or intravenously. It has been proposed that an alteration in the osmoreceptor cell's metabolism could be responsible for the reset osmostat malfunction. The syndrome of inappropriate antidiuresis is one of the paraneoplastic syndromes, which has a well-established linkage to small cell lung cancer. It occurs in 7 to 16% of small cell lung cancer cases and has been linked to worse outcomes in patients with small cell lung cancer. This case is unique as SIAD was one of the presenting features of the patient's small cell lung cancer. A possible mechanism for SIAD due to lung cancer is discussed.